Hello everyone, Rachel from Bare Body Shop here. I am a nurse practitioner and the owner. I'm going to be telling you about our newest device called TriLift today. So this is our TriLift, and the cool thing about TriLift is that we can do 3 treatments in one. We can use dynamic muscle stimulation, we use radio frequency energy, and we use needles, all to do different things in the skin. We have our beautiful nurse Heidi here today, and right now I am just prepping her skin. So you can see she has gorgeous skin already because she does all the things. She does the treatments that induce collagen, she does good skincare, sun protection, she does injectables, she does all the things, so her skin is gorgeous. So we are just cleaning her face and her neck, and we use 2 different types of cleaners to prep the skin. Just make sure it is ready for the treatment that we're about to do. So now that Heidi's skin is prepped, I have a glycerin slip that we're going to use just so that I can glide across the face, delivering equal amounts of energy to her areas of concern that she wants to work on and tighten up. So right now we are using both radio frequency energy and dynamic muscle stimulation. And so we are targeting 4 very specific areas to lift and tighten and rebuild collagen. So you can see she is starting to get a little bit red. That is totally normal with this treatment. We're heating up her skin so that we can produce that beautiful collagen to help the skin health and the quality of the skin. So as you can see, her muscles are starting to twitch. And this is not Heidi doing this. This is just her response as we contract the muscles in her face. So she's getting some good muscle contraction here. And at the same time, we are delivering that heat or radio frequency energy. By doing the treatment in this location, we are hitting so many concerns that patients come in and talk to us about all the time. Everyone comes in and says that their face is starting to drop or deflate with gravity. And so this is going to help to lift, tighten, and pull back. We have started the dynamic muscle stimulation. We call this holds that we're doing on the patient. So right now we are targeting very specific nerves. So you can see that we are grabbing onto that muscle and contracting it, and that's why she's having those little twitches. This is a really, really good response, and we're going to continue to do this in different areas. So now you can see different areas of her face are contracting. And some of them can be pretty spicy. Mm-hmm. That is totally normal, especially as we approach the perioral area. We can be pretty zippy, but it is so worth it. We're going to come around kind of to this nerve over here. So what we're going to get with this is a nice tightened appearance. Patients will often see a difference in their nasolabial fold area. That's such a common area of concern, and we're targeting the muscles, the muscle groups right in there. Patients will see a tighter jawline, a more lifted jawline, more defined cheekbones. Oftentimes, patients will even see a little brow lift. So here we are using the dynamic muscle stimulation to really target specific facial muscles with our holds. So we are doing different repetitions, almost like you're at the gym and you are working your biceps and you're working them over and over again. It's very similar to what we're doing here. So we're targeting those muscles and we're really giving them a good workout to lift, strengthen, and sculpt the face. I love this treatment for so many reasons. It has some immediate benefits. So, you know, patients can often see the effects right away for that muscle stimulation. They appear lifted and sculpted, but also you're getting more long-term effects with your collagen that you're building. And when we do our microneedle portion, you'll see just kind of how we microneedle the full face and neck, and you're gonna get even more collagen stimulation from that treatment. Here we are looking at Heidi's before picture. So Heidi has beautiful skin already, but she wanted to target the nasolabial fold area and the pre-jowl sulcus area. And so we did that today. As you can see, we did one side of Heidi's face. We worked on her right side. And if you look at her nasolabial fold area, you can see that on her right side that was treated, she has virtually no nasolabial fold. She has very soft, natural nasolabial folds on the left, but now we've lifted that and softened the transition between her cheek and her perioral area. If you look down to her kind of chin mouth area, we call that the marionette area, and the jowl area, you can see the difference between the transition from the treated side on her right. It's nice and smooth transition, and there's virtually no pre-jowl. If you look at her left side, the before, just ever so slight. I mean, Heidi barely has any pre-jowls, but we are getting them before they start. Here you can see that on the treated side, she is lifted and sculpted. Her cheekbones look much more defined. Her, again, transition between the cheek and the nasolabial fold is softened so much. The corners of her mouth are even a little bit more turned up because we are pulling that muscle up. And if you look at her jawline, you can see it is just nice and smooth and snatched. We are getting ready to start the microneedling phase of Heidi's treatment. So we have different lengths of needles that we can use based on the patient concern. I am using a length that is just really good for overall rejuvenation and collagen stimulation for Heidi. Okay, so we are gonna do a full face and neck treatment on her. And let's start at the forehead. So as you can see, Heidi does tox, so that's a really good combination treatment. Tox is working on the muscles as well, and it's just relaxing those muscles. So you can see how beautiful and soft and smooth her forehead is. But we also want to work on the skin, and that's what the microneedles are going to do. So at the same time that I am emitting the microneedles, it is giving off radiofrequency energy, which is creating a thermal injury, and that's going to help her body stimulate collagen. The more collagen, the better. Doing okay, Heidi?
I might have to sneeze. I'll let
Yeah,
you know.
okay. You just let me know, girl. We recommend 5 treatments for everyone for TriLift. That is a really good baseline that pretty much every single patient needs. So we start you off with 5 treatments. We'll come up with a plan for kind of the sequence of those treatments. But basically, we're going to be microneedling you. We will use dynamic muscle stimulation and radiofrequency energy to give you that beautiful lifted result. How you doing, Heidi?
Good.
Good. So, as you can see, Heidi is tolerating this very, very well. And I did forget to mention that there is no numbing cream involved in this treatment. And you know, for microneedling, that is pretty impressive. We have other microneedling devices where we use high dose numbing cream to make the treatment very tolerable, but this, you don't need that. which is pretty cool. As you can see, the treatment is pretty quick. We're just kind of moving right along using probably a moderate amount of radiofrequency energy along with those needles for each little pulse that I'm doing. And you can see she's really not bleeding. There might be a few areas here and there, maybe if there's like a superficial capillary, you might notice, you know, kind of a little bit of blood, but it's not too bad. We do let patients know that you're going to be red after this treatment. We're creating that thermal injury as well as the needles. And so this is a pretty good depiction of kind of what most patients look like after. It's normal to have some swelling and inflammation as well. So we do ask that patients plan accordingly. We don't want you to have any important events coming up in the next 2 weeks or so before your treatment. When you microneedle, there are so many amazing benefits to it. So not only are we microneedling, but we're also emitting or delivering radiofrequency energy into her skin. Microneedling can also shrink pores, help with texture, tone, just the overall skin radiance and glow that you get after microneedling is unlike any other treatment. And then you add on the radiofrequency energy. That is really the gold standard of skin tightening. So not only are you getting all of those benefits from the microneedling, but you're also tightening up that skin, lifting that tissue with radiofrequency energy. It's a win-win. You cannot go wrong with this treatment. As far as downtime goes with this treatment, everyone is a little bit different, but you can expect to be red. You have that your body's inflammatory response that kicks in, and as you can see, Heidi's red and inflamed. And then kind of your redness is going to go down over the next few days. It can be common to have a rough and bumpy texture to your skin. That is totally normal as we are increasing the cell turnover of your skin on purpose. So it's very normal to kind of feel that rough and bumpy texture. Once you are healed fully, you're going to reveal just a nice, smooth, glowing, baby soft skin. All right, so we just finished microneedling Heidi's face, and now we're moving on to her neck. So we always say, do not forget the neck, because it's aging just as much as your face is aging. It gets just as much sun exposure as your face, so don't neglect the neck. So we're gonna go down and kind of do the same thing that we did on the face. We're stimulating that collagen, tightening that skin. An important area that we always like to treat is what we call the submental area. A lot of patients come in and say that they, have tech neck, or they can see kind of a fullness on the neck under the chin area. So we call that submental fullness. And we're really able to target that and just help with that skin tightening and tissue health.